My name is Shital Pema. I've been practicing in Dayton, Ohio for the last 18 years. I've enjoyed a mixed practice. I was in the military prior to private practice. So I've seen both trauma and sports medicine-like practice, and I've experienced a more community-based practice. Over the last 6 years, my practice has shifted and become subspecialized into more limb salvage with fracture care and musculoskeletal deformity correction. I started using the Seal products because I had a complex case. The patient had gone through multiple medical opinions. As I studied the case myself and understanding the complexity of the situation, I reached out to colleagues across the country. I had multiple referrals for using a Seal product in combination with internal fixation, and this is what really got me started on the use of the circular frame. Eventually, with my own experience with other patients, other products, and recently I used the pin and bar system in comparison to other systems that I've used. Modularity and ease of use of the Seal product is by far more beneficial to both the surgeon and the patient. Come to appreciate that restoring form, locking down the deformity, locking down the fracture, and restoring function is simpler. Patients benefit from provisional fixation and having a staged procedure with definitive fixation over time tremendously. It's safer for the patients, and the principles of management of fracture and musculoskeletal deformities has never been more easy. I personally have had patients with multiple comorbid conditions, and managing their care safely with staged procedures where there's provisional fixation and definitive fixation later on has allowed them to at least have a quality of life as opposed to having a low knee amputation. It's not limited to just external fixation. The idea of having provisional fixation with external fixation and then definitive fixation with internal fixation has always existed, but the versatility with the current technology makes it easier. Typically, in the civilian setting, the patient has comorbid conditions. When you have provisional fixation with especially the speed frame, you can stage things out. You don't have to get an outcome that is going to improve the quality of life for the patient. This kind of technology allows for a staged procedure where you can do definitive fixation later on and still observe safety for the patient's care. I call it the lock and load method, where you have provisional fixation with the speed frame, stabilize the patient, and then come back later once the infection is gone, once you've restored and locked in the position of the form. You can come back and do definitive fixation, whether it's internal or external. I'm just appreciative of the technology allowing that level of care. More so than using just the product, I think with the Seal Academy, you're introduced to a number of surgeons throughout the country that can share their opinion, and often you have a collaboration to help with complex cases where there is no standard of care. The network provides a support and thought process, and ultimately that benefits the patient.